So one thing I want to describe is what's happening here is a lot of tension. So this patient gets pain in her left side, her left hip, and her right shoulder, which is really common. So she feels a lot of tension in that hip flexor, in her low back and her hip. We've done a lot of work in the past on releasing the SI joint in the left side. But what's still happening is there's a lot of tension as I come down her leg, a lot more tension in the hamstring on the left side. And it's difficult to see, but her hips are a little bit, if we just have even just the underwear line, just a slight angle. So there's a little bit of a pull happening down the left side, angling the hips this way. So when I come into here where the hamstring attaches, now you can maybe see like the flick. That's a big adhesion, clumpy bit that's adhering that hamstring to the joint. Ischial tuberosity there. So basically, even when she wants to bend forward or bring her leg up or do something, the hamstring's really tugging. It doesn't have a chance to release because it's glued to this ischial tuberosity. So what happens is then if I pull this sheet this way, you can even start to see an angled wrinkle in the sheet going toward the right shoulder. And as I pull here, so we can see if I pull this hip joint, there's an angled fascial pull in the sheet to the right shoulder, which is where she gets a lot of tension. So what I'm going to start to do is break down this adhesion a little bit. I won't show you the full treatment today, but just the description of what's happening, and we'll get the patient to nod if she feels that this hamstring is released after. You can feel, just nod if you can feel that this is much tighter than this one.
Yeah.
Okay, so this is just gonna feel like it usually did on this joint when I scraped it before.
Okay. Oh gosh.
Yeah. I haven't done this one area on you yet.
No.
This doesn't hurt that much.
No,
it feels funny, most likely.
Yeah.
And you can use a scraper, which I find better. You can use your hand, but I find the scraper more effective. And again, I'm just going around the bone. Obviously, you have to build trust with someone before you start scraping their bottom area. There we go, starting to come off a little bit. You don't want to go too much because then there'll be too much inflammation. But just enough to get that release, and then you can continue the next treatment. Oh wow, it's much better.
Yeah.
Well, this is just to show that although I will work the hamstring, there'll also be like an immediate release in it because letting go of this grab. It's like a hand just grabbing on to there.
Even here feels less tight, like my low back here.
So right now the patient just said that her low back suddenly feels looser on the left side. So what I'm feeling is like more of like that mushy feeling. You'll get some edema that kind of comes into the area. That you have to be mindful not to have too much rush of that. And I'm also feeling it breaking up, like instead of it one big clump, then it becomes little clumpy bits and kind of moving around. And less snapping that I'm feeling. There we go. So, that's Also kind of gripping is just a little around the greater trochanter, the gluteal line. Okay. Now this is perfectly fine to do over the sheet like I just did. Now, what does it feel like?
Almost tighter on the right side.
Yeah.
Well, obviously it is.
Like I'm getting my thumb in there way more.
Yeah.
It feels almost about, at least a 30% release in there just from releasing off the getting rid of that adhesion and breaking it down. So I will continue with the treatment. Thank you.